right, Julie, you're here with us today looking for some answers, trying to find what's going on with this mystery pain. Go ahead and kind of run me through, like, when did this start? What are the symptoms you've kind of been dealing with? And what have you tried to get for relief?
Okay, so years ago, I was working out, doing CrossFit, and I knew my neck, for some reason, I shouldn't mess with it. And I was really careful, but one day I decided to go ahead and just do the workout and use my neck. And that was a bad choice. So since then I had neck pain. My shoulder muscles were all clenched around my neck, headaches, pain down my arms, numbness, tingling in my fingers, pain down my legs, and numbness on the sides of my feet. So it hurt to hold a book or hold the steering wheel or do dishes or anything that use my arms.
Sure.
So went to the doctor. They had no idea what was going on. I went to see someone in sports medicine and they tried some things on me that didn't work. I went to a shoulder doctor and they ran x-rays and said everything's fine. I went to, I think, a neurologist who couldn't find any explanation that made sense. Mm-hmm. And I ended up at the pain clinic in Portland, and they did things to my neck to try to get things to stop clenching. And then at that point I gave up because nothing was really working and I didn't want to continue with neck injections. So sure. I just went home. And I just I did physical therapy, but I quit that as well. And I eventually just listened to my body, which was saying, nobody touch me. Don't do anything. And so I did that for a long time and everything has calmed down and my fingers aren't numb anymore. And now it's kind of gone to, I'm just down to the basics, which is my neck, my headaches, and my jaw. And when I started feeling pain in my jaw more clearly, that surprised me. I didn't really anticipate my jaw being part of the picture. And so, I went to a cranial sacral doctor who told me to see you.
Okay. All right.
And that's how I came here.
So you have quite a few symptoms. Most of that, just to reiterate, most of that's gone and you're left with kind of jaw and neck concerns. Is that fair?
Yes. And I can't sleep on my side. If I do anything weird with my shoulders, nerve pain starts up. So I sleep very still on my back. If I roll onto my side accidentally, I start getting a deep, bad feeling and I roll onto my back again.
How would you say your quality of sleep is?
I'm actually a great sleeper. So
okay.
I can sleep on my back and I'm pretty good, but it is annoying to not be able to snuggle with my husband. That is a big downside.
Sure.
Yeah.
Okay. And how long has this been going on?
I want to say 2.5 years. It could be longer because COVID's kind of messed me up. I don't remember the exact start date.
Sure. Well, COVID messed a lot of people up.
Yeah.
Have you seen a dentist for this?
For this? No.
Okay. All right.
It didn't occur to me.
Okay. Well, I mean, the jaw pain.
Yeah.
Would the jaw pain is what kind of leads me to ask that question. Mm. Okay. So what we're going to do today is I'm going to hook you up so that we can listen to your muscles. We've already done a cone beam. We're going to be checking your bite just to see if anything's off. And in our consult, we found that something was, and you could be corrected, right? Do you have any questions, concerns, comments about what we're doing, what the plan of action is today?
Nope.
All right. Then I'm going to get Ashley in here and we're going to get started. Go ahead and open. Just relax. Good. Go ahead and bite down. And open. Bite hard. And open. Bite hard. And open. Bite hard. And open. Good. We're going to do 2 more bites. I'm going to have you bite and hold. And then I want you to shift the right jaw towards me.
Lower jaw?
Lower jaw, yes. But don't do anything until I tell you. Bite and hold, nice and tight. Shift right. And open. Yeah. And then, of course, now we're going to go to the left, bite and hold nice and tight, shift left, and open. Good.
Right off your teeth first, and then open. Slide your teeth together. Tap, tap, tap. Bite and hold. Move your jaw to the right. Back home. To the left. Back home. And open. Stay open.
Julie, you just had round 1 of DTR, and I wanted to ask you, when you bring your teeth together, what do you notice?
Feels very different.
Sure.
Feels like there's fewer obstacles somehow to like how they settle.
Sure.
Yeah.
Do you feel like when you bring your teeth together, it hits repeatedly at the same position?
I think so.
Okay. Does it feel like it's more balanced right to left?
I think so.
Okay.
Yeah.
And you asked me a question about what do the electrodes do and why do we have those on, right? And that's to listen to what the muscles are doing as I'm doing the adjustments. And you said, and I said, your muscles have already started to relax just since you've been here. You're like, well, how do the muscles know? How is it that fast, right?
Right.
Because this is new for dentistry. Usually dentistry is like, 4 to 6 months. We'll figure out, find out where we're at.
Yeah.
Right. Okay. The reason why it's so fast, it's a neurologic answer, not a biomechanical. And most of dentistry thinks in terms of biomechanics. Okay. Mm-hmm. So the periodontal ligament, which is the ligament that holds the tooth into the bone, has 1 million receptors per tooth. The compressibility of those ligaments is registered in the trigeminal motor nucleus. So that is the part of the brain that controls the muscles of mastication. Essentially, there's other ones, but these are the 4 main ones, okay? And the interesting thing about that nerve is that it doesn't synapse before it goes into the central nervous system. The peripheral nerves from your feet, your hands, other extremities of the body will synapse first and then go into the central nervous system.
Yeah.
This one doesn't. There's only one other peripheral nerve that does that, and that's blink. Because blink has to happen very fast. Otherwise, we would get all sorts of schmutz in our eyes, right? The same thing happens when you're chewing. If you're expecting to chew, let's say, a piece of fish, and you got a hunk of gravel in there, there better be a reflex that's very fast so that your mouth comes apart. Mm-hmm. Otherwise, we'd probably break more teeth than we do as human beings, okay? So that's how the neurology acts.
It's so fast.
Very fast, yeah. So I want you just to, just kind of rotate your neck to the right, to the left. Notice anything different?
I think so. I felt like before we started, I just had all this tension sitting here that I'm just kind of used to. And I feel like that's it's like not there right now. But I don't know if that's because I was laying down and I just came up, but it's like noticeably absent, this like just little ball of tension right there. And then my neck tends to be like stiff and kind of like I'm always aware, like, should I be stretching it or, working on my neck? And just right now, it just feels like easier somehow. Like there's just this is like relaxed or gentle feeling.
So there is a muscle cascade of related or associated muscles. And when one set starts to relax, the others will cascade with them. So yeah, my fingers are crossed too. But that explains, and it's not just you that it happens this quick on. We see it across the board because we treat people like all over the United States, all over the world, and we continue to hear the same things. Now, the interesting thing is not all of your symptoms are gone, right? But the muscles have started to relax. So it's not us waiting 5 and 6 weeks or 3 or 4 months to find out what the result is. It's like before you leave today, the benefits have already started.
Change. Yeah.
Yeah. So now this is an interesting therapy because with the with something like an orthotic or a night appliance, you take that in and out, and so the therapy is dependent upon patient compliance, right? If you get sick of the thing, you take it out if you're having a bad spell, and then when you come back to the dentist, he adjusts it. Well, here there's no getting off the train.
Right.
Okay. So if you get into a bad spell with your symptoms, or you notice like, wow, my bite feels really funky. It doesn't feel like when I left Dr. Sutter's office. So if you're coming in a few days or a week, hang in there. If this happens next week and I'm not seeing you for another 3 weeks, don't hang in there. Call the office. I want to see you. And some of it is, some of it is going to wax and wane. You're going to notice that you're still going to have good and bad days, right? What is going to be different is your bad day is not going to be an 8 out of a 10. It's going to be a 5 out of a 10. And your good days are no longer going to be a 6. They're going to be a 2. Okay. And as time goes, slow, steady improvement is what we're looking for, but it can be very drastic improvement as well. I know, like for me, my throat and my headaches were almost non-existent after this. My shoulders took 18 months. So just kind of know that. Okay. And unfortunately, you don't get to pick and choose what symptoms get better faster and which ones don't. We just kind of play the hurry up and wait game. Any questions for me about anything?
I can eat anything I want. I don't have to worry about temperature at this moment.
That's a great question. And so where a lot of TMD docs will differ from me is they'll say, I want you on soft foods. I don't want you eating anything that has good resistance. I don't say that. Eat whatever you want. Okay. Because the whole idea is we want to figure out what we accomplished. And so if you're a person that, every time my husband cooks steak, I love it, but I get so tired chewing it that I can't finish it. Okay. Well, the best way to see what we got is for him to cook you another steak and let's run through it. Right.
Okay.
So, now some common sense stuff. We're not going to go out to the coast this weekend and get a bag full of saltwater taffies and chew on that. So we have to temper this with some common sense stuff. But as far as like normal eating and food that you would eat, eat whatever you want.
Okay.
And
hot beverages, okay?
Yeah.
Maybe I'll just be careful and see.
No, so let's talk about the temperature, because sometimes, or a lot of times online, we'll have the cold sensitivity is like immediate, right? It's not always. Do I want you to avoid anything? Well, no, because we have to figure out what the benefit was. I don't think you should run out to Starbucks after you leave here and get the hottest coffee that you can get, right? Again, let's temper it with a little common sense, but
over the next week, just eat whatever.
Yeah, next week, it's going to be, probably, 3 or 4 weeks before I see you again. So you're going to have multiple times to check it. And if it's a slow, gradual thing, it'd be like, I think, the first week, I think there's some improvement. The third week, it's still there, but it's definite improvement. So some of these things may take a length of time. Because again, you've been working on this for a minute.
Yeah.
It just hasn't been since COVID. Okay.
Right.
We were clicking and popping in high school. Yeah. Okay. All right. So you were a latent sufferer. All right.
Yeah.
Other than that, any other questions?
No, I think I'm good.
All right. Well, I'm hopeful for you, and we'll see you back here soon.
Me
okay.
too.
All right. So Julie, welcome back. It's been 4 weeks.
Yeah.
About.
Yeah.
And so you've had your initial DTR revision, and you're coming back for a follow-up, and I just wanted you to take me through the things that you noticed since last time to today.
Okay. So the minute you had done the DTR, I noticed like the muscle tension starting to relax immediately. And then as we were driving home, we stopped and got some food, and I was eating a little carefully, and I could tell that my mouth was so happy and wanted me to bite. and like was enjoying every bite. It was so weird. Like just crunch it and just like so happy. And then my mouth wanted me to chew like a cow with a round motion. Like I don't even know how to describe it. So the whole way home I'm like, I can't stop like just feeling so happy that my mouth can move, and the muscles were like, yes, just chew. It was really strange.
What were you eating? I'm just
I
curious.
think it was like a sandwich or something, but it was like so happy. And that lasted for a couple days, just like this happiness and chewing.
Sure.
The other thing is that pretty immediately, just my overall pain levels and my overall awareness that I have this constant jaw pain, shoulder, neck thing just dropped to the background. So like I'm having my day, and at the end of the day, I'm like, yeah, my neck was sore because I had this jaw thing, but I had forgotten about it all day. Right. So it was like, it was there, but it just moved from the foreground to the background, which is wonderful.
That is wonderful.
Yeah.
So less intense, less frequency, duration. Is that fair?
Less present, just maybe sometimes when it just wasn't even there. So I just wasn't paying attention to it.
Sure.
And then it would pop up like, oh yeah, because I have that thing. But it went from being like all day, like I should sit carefully. I should hold my hands when I'm driving a certain way. I should remember to stretch constantly. It just all moved to the background.
Good. So that's quite an improvement.
Yeah.
Considering it's only been one visit. All right. Well, good. Are you glad you did it?
Absolutely.
All right. Wonderful. Anything else that you've noticed besides better chewing and less head, neck, shoulder tension?
Just like the way my jaw moves feels more fluid.
Sure.
Like just looser.
That's fair because you have a greater range of motion now than you did previously. You were kind of locked, which is the reason why the muscles were always tense and trying to avoid certain areas.
Yeah.
All right. Anything else?
I'm looking forward to today to see if it gets even better.
Sure, fair enough. Well, I think usually what I observe is patients will have the greatest amount of improvement early on, and then what happens is a slow, steady improvement moving forward. It would be nice if it's like, okay, here's another huge plateau. That's not realistic. That's not what we observe. Although, every person is an individual and they get treated as such. And so everyone's experience is going to be unique to them.
Yeah.
All right, perfect. So
every little bit helps.
100%. So you say every little bit helps. If you were to give me a percentage from pre-treatment to today, is it 20% improvement? Is it 50%? Is it 70%? I know it's totally objective.
Yeah.
Subjective.
I would say like if before my pain and everything was kind of a 10, I'm now at a 6.5.
Then for 1 month, that's amazing.
Yeah.
And what about medication? Are you taking less medication? Any medication?
Less medication.
Okay, perfect.
Just like Tylenol, Advil stuff, just less.
Less of it. Okay. Any questions for me before we lean you back, check you out?
Nope. I'm good.
All right. Excellent. Thank you.